So what can a person expect to have happen? I mean, if they go to somebody called an EMDR therapist, and what's going to happen to them?
What's going to happen?
Yeah.
Basically, the therapist is going to do a thorough intake and a thorough interview and find out a lot about your history and what experiences brought you to the session to seek EMDR. When they actually begin to do EMDR, they're going to target a memory that you have, or either a image of that memory or a memory, and then they're going to have you think about that, and they're going to have you identify some negative beliefs that you have as a result of that. They're also going to do some scaling questions and have you identify a positive belief that you would rather hold with that image. And then basically the therapist is going to sit kind of like two trains passing in the night, or two trains passing on two different tracks, so that they're sitting kind of catty-corner to each other, and then so that there's not a direct line of eye contact. And then while the client is holding this in memory and following this protocol that the therapist helps the client to set up, then the therapist has the client follow their fingers back and forth, kind of like this in this motion. And we recommend that you not ever try this at home. You need to know that this is a very complex, difficult treatment. That this is a very complex treatment. And it looks deceptively simple, but it has a very robust protocol. It has been well developed, and the therapist would then, after doing the eye movements, ask the individual what do they notice, and the level of processing that you will notice as a client having had EMDR it's a deeper quality of processing than you've ever experienced before. You just think more deeply about things, and that it also helps to alleviate some of the tension and the distress that you feel while you're thinking those thoughts.